Philadelphia is considering opening a site where drug users can go to legally use drugs. They would be monitored by medical professionals who would administer anti-overdose medication as needed. Medical professionals. How would you feel about having this job? Submitted by Rascally 1980. They tried to do this in my city, but no one wanted one in their neighborhood, or near their kids' schools, or near where they worked, etc. Dude, I gotta narcan people in a park. I'd much rather do it in a clinical setting where they know I'm gonna do it, so they're less likely to try and punch my lights out for fucking their high up. There's a harm reduction place in the Bronx like this already. It's grown quite a bit since I found out about it through my job years ago. But when I was there, it was a drop-in place where drug users could go. I met a few. The reason it works is because it gets people in who would otherwise be totally not connected. Now they have access to all kinds of medical and social services. They might come for the clean needles or shower, but it's so much more than that. Not only does it help them, but from a public health perspective, it also helps stop the spread of diseases like HIV and Hep C. https://www.boomhealth.org/solutions. Amsterdam. We have them in Canada, and they are an effective means of harm reduction. Not only do they provide people with clean injecting equipment and intervene in case of overdose, they also lead to increased use of detoxification services. I'm not a fully qualified medical professional yet, but I can definitely see the need for services like this. It's not something I necessarily want to go into. I'm leaning towards specializing in emergency medicine. Harm reduction strategies like supervised injection facilities would probably lead to a reduction in emergency department visits for drug-related problems. Public health worker here. What everyone is missing is that it is a harm reduction method. No, it's not ideal, but it's going to happen whether or not we like it to or not. So it's better that they do it in a safer, sterile environment. I recommend y'all to read High Price by Carl Hart. A lot of you have strong misconceptions about addiction and the role of social aspects like community play in addiction. Also, welcome to public health. There is no perfect intervention that will solve all problems. People are too complex for that. The ones in Vancouver may have medical professionals available, but the people who work at them are much more likely to be just employees. It is a unionized job. Here, many people have a background or education in social work, but not medical degrees. I know a lot of people I know who work in these services who are musician friends who like it because they can take time off to tour whenever they want. They are not easily frightened by how crazy it is, have very left politics, and like helping people. Detox is literally in the same building on a different floor than the one in Vancouver. And the people who work in these places tend to go to all different buildings that are administered by the same or linked organizations. So the people working for the safe injection site would also be working at single-room occupancy places, or other mental health services, homes around the rest of the city. There is a lot of issues with corruption amongst the people in charge of these organizations. In my city anyways. And many of the workers end up having to do leaves of absence or go on workers' comp for PTSD. Due to the amount of severely fucked up shit they are dealing with all the time. And not being given proper support by the people in charge, cheaping out on following safety procedures and abiding by the rules of their own union. It's an extremely difficult job with huge burnout rates. For a better idea of what it looks like here, and to evolve some people's black and white opinions regarding addiction, I highly recommend books by a doctor who works in Vancouver's downtown east side. Gabor Mate. They are a good idea in hindsight, but in saying that, I have seen what happens around the surrounding areas. It is a massive downside to them is that there isn't enough rooms in the one in my area, which causes one major issue which leads to other issues. The issue been that people go there and have trouble waiting to have their hit, so they are having their hit in the car park and surrounding areas, which is in plain sight of other businesses and school kids in the area. Hence the next part of my story. There are people, drug dealers, who prey on these people with the knowledge that they will be impatient and are selling the drugs to them in plain sight, which once again is right in plain sight of above-mentioned areas. As a result, it is painting parts of the area in a bad light and is slowly decaying the businesses who have become fed up. People are coming across from all parts of the state to the safe injecting room, and there simply isn't a big enough facility to deal with the amount of people that come. Medical professionals already do this job, just without the convenience of actually having the patient there. So instead of a patient ODing with clean needles and getting Narcan ASAP in a controlled medical setting, they don't find out about the OD until 30 minutes after, and they have to go find them in an ambulance. In a world where drug addiction is a reality, safe injection sites just make sense, and will save money, time, and lives. Medical professional here. I couldn't do this job. I understand the argument and I'm not 100% against it. But for me it wouldn't line up with my personal understanding of do no harm. While I'm not putting the drugs into them, it feels too much like I'm being a part of enabling themis. You're sitting by and allowing people to do drugs 5 feet from me that could potentially kill them doesn't sit well with me. I'm all for making drug-related interventions, therapy, rehab, etc. more available. But this doesn't feel right. Edit. I am trying to say I wouldn't work there. I am not trying to say others can't. We have this in my town. It saves dozens of lives a month. Not a medical pro, but we have one of those here in Calgary, and they were trying to open up a couple more, including by my house. They do prevent overdoses but also greatly cause a rise of crime in the surrounding area. I didn't want one near my house. Nor would any sane person. Don't get me wrong. I feel horrible for opiate addicts. I carry naloxone daily. But I feel like there needs to be a better strategy for helping them than spending millions of dollars to give them a safer place to overdose. Throwaway here, so hopefully nobody identifies me. I don't see a lot of medical professionals in this thread, so here is the perspective of a registered nurse who has cared for OD patients and patients with history of IV drug abuse, addiction. I could never work in a setting like this, and I feel that most of my colleagues would agree. 3 major reasons come to mind. And X200B. 1. Ethical, health concerns. I cannot ethically condone drug use under my watch just to give them Narcan and let them continue to use those drugs are harming the person. Giving them a safe space to use by eliminating the risk of overdose does not reduce all risk, harm of using the drug. IV drug users are at major risk of infective endocarditis. This is when bacteria enters the bloodstream as your repeat venipunctures push bacteria on the surface of the skin into the blood vessels. This bacteria attacks the heart valves, causing major damage to the heart and requiring open heart surgery to replace the valves. If left untreated, will lead to heart failure and a painful death. Even when treated, life expectancy is drastically reduced. 2. Legal concerns. What if, despite my best efforts, the patient overdoses and is unable to be resuscitated? Am I liable for malpractice? What if the person develops one of the many other complications from IV drug use? Am I liable for those because I was a trained medical professional available to them when they were using? A good malpractice lawyer would have a field day with this. Not worth losing my hard-earned license. Career over. 3. Safety concerns. Illicit drug use and IV drug users can sometimes be desperate when looking for their next fix. I have been threatened in my current practice setting for not bringing pain meds fast enough or not giving higher doses than prescribed. I have colleagues who have been assaulted for similar issues. What if I am threatened, cornered, robbed on the job or outside? Will there be enough security to handle this? I'm not judging a book by its cover. I care for patients with IV drug use and their complications on a regular basis, and I don't treat them differently than anyone else. But these are valid concerns that any healthcare professional would having working in this setting. How would you feel about posts need to stop on this sub? There's basically two answers possible. One will get upvoted for being what Reddit agrees with, and the other downvoted. In keeping with the original question, I personally would not want to have the job. It would fundamentally alter the way I currently practice, and this far into my career I don't think it would be safe for me to perform this particular job. I do see the value in the service, but it will take a very specific person to do the job. You want someone that not only knows how to monitor and reverse the narcotics as needed, but also someone that knows the difference between someone just being really high or actually dying. If the staff just goes around reversing all the intoxication, then nobody will use the space at all. We already know that Reddit is overwhelmingly in favor of this. You're just asking a leading question for easy upvotes. Doc here. It seems like a thankless job. I feel like people would take things to the edge, knowing they would be rescued. Not a medical pro. Sorry, but this is a great idea. Gives the pros an opportunity not only to provide clean needles and life-saving counteractive drugs, but also an opportunity to sit down and compassionately discuss options to struggling addicts, and offer them resources to help them get clean. Just throwing them in jail with little to no psychological assistance clearly is not working. A more human, empathetic approach is needed. What's stopping cops from arresting them as they come and go for possession? Also, is it really a good idea to give people a free pass to use heroin all the time? They're still going to be stealing to fund the addiction. They should be put in rehab instead. These areas are very effective at preventing drug overdoses and transmission of diseases. They also provide help quitting if wanted. Treating drugs like a public health issue has proven to be highly effective. One especially great case is Portugal. Harm reduction saves lives. For many reasons, having a safe drug use site is just one of them this year. That being said, working with a population that's actively using, and occasionally contemplating quitting, and frequently relapsing, that work isn't for me. The cycle of addiction is emotionally exhausting and repetitive, and I'm not personally passionate about it.